Welcome to our Workplace Health Podcast. I'm Garlana Matthews, President and Editor of Workplace Health Magazine, your trusted source for comprehensive information on workplace health and wellness. Each month, I will be sharing interviews with leading industry experts to empower employers with the knowledge and resources needed to create and sustain a culture of wellness. Whether you're a business owner, HR manager, or employee, Workplace Health is your go-to resource for staying up to date with the latest trends and best practices in workplace wellness. If you're ready to address the diverse needs and challenges faced by businesses today, you're in the right place. Let's get started. We are excited to have Marcellina Scott from DOAS join us today on our Workplace Health podcast. We also want to thank the Georgia Workers' Comp Association and their GWCA chairman, Amy Salmon, for sponsoring this presentation. Marcellina Scott joined DOAS in 2023 as a Workers' Compensation Program Manager and was promoted to Indemnification Program Officer in 2025. She has 13 years of public sector experience with 5 years of risk management experience and 26 years of legal experience. Marcellina earned a Bachelor's of Art degree in Sociology from the University of Cincinnati and a Master of Arts degree in Public Administration from Northern Kentucky University. During this webinar today, she will discuss the indemnification program's rules and regulations. Thank you, Marcellina Scott, for joining us.
Good morning, everyone. Thank you for your time and attention. I'm going to go ahead and jump in right to the presentation. So the program was first enacted in 1973, and it provides financial benefit for public safety officers who are injured or killed in the line of duty. In 2000, the second part of the act was added, our supplemental program, and there's also financial benefits for public school employees who are killed or permanently disabled by the act of violence in the line of duty on or after July 1st, 2001. A public safety officer must be killed or injured during a work-related activity while in the line of duty. That duty must be non-routine and must be considered strenuous or dangerous by a reasonable person. A public school employee who is killed or permanently disabled by a willful act of violence must be by a person who is not a fellow public school employee, and it must occur in the line of duty while performing services and receiving compensation from the public school district. Both parts of the act require the same statutory tests to be met, which means that we must be comply with the Georgia Code requirements. There's no assumptions or guesswork in improving our claims. So who's a public safety officer? Law enforcement officers, police officers, firefighters, volunteer firefighters, Georgia Forestry Commission employees, prison guards, correction officers, jailers, publicly employed EMTs, not private, emergency management rescue specialists, state highway employees, and any member of the Georgia National Guard who's called in active service by the governor for law enforcement purposes, a professionally certified teacher who's employed in the public school system of Georgia, and public school employees, classroom aides, paraprofessional, non-certified administrative, and clerical personnel. And our supplemental benefits are only for law enforcement officers and firefighters. So non-routine, stressful, or strenuous activity means action that is not clerical, administrative, or non-manual in nature. So referring to, desk on duty. Work-related activity means while in the line of duty, the officer is engaging in a situation involving non-routine, stressful, or strenuous physical activity related to law enforcement, fire suppression, rescue, hazardous material response, emergency medical services, prison or jail security, disaster relief such as hurricanes or tornadoes, or any other emergency response as classified by the Indemnification Commission. Also participating in training exercising involving non-routine, stressful, or strenuous physical activity, but an officer must be certified by the state, and the firefighters must be certified. So that excludes any firefighter or police recruits. So part one addresses fatal in most cases, career-ending permanent injury suffered by providing benefits for death and total or partial permanent disability. Now, our disability claims are different than workers' comp. Some of the terms are similar, but our claims, you have to have a loss of use. So for partial permanent disability, that means the loss of use of one eye or blindness in one eye, loss of one hand, loss of one leg, or the loss of use of the lower extremity. That means that you're unable to walk without any mobile equipment for a short distance. So for total permanent disability, that means the loss of both. So the loss of both eyes or blindness in both eyes, loss of both use of both hands, loss of use of both legs, and loss of use of the lower extremity, where you have to use mobile equipment at all times as being a paraplegic. And total permanent disability also includes organic brain damage. And it defines organic brain damage as direct physical trauma to the brain that so affects the mental capacity as to preclude function and productivity in any employment. So our total permanent disability for organic brain damage means you cannot perform in any employment, not just your regular work duties. So House Bill 1128 provides a special application window for organic brain injury. So that new application window is going to open July the 1st and end on August the 1st, 2026. And that provides total permanent disability benefits for any officer that was diagnosed with organic brain injury on or before July the 1st, 2024. So what that means that if an officer or their legal guardian submitted an application prior and it was denied by our program because it wasn't submitted and within the 24 months requirement, or if an officer never submitted or their legal guardian never submitted an application and they were diagnosed with organic brain injury prior to on July the 1st, 2024, they can submit a new application. There's also a requirement in the law that the State Board of Workers' Comp and any law enforcement agency must inform legal guardians about the program. So of course we know that if you have a brain injury, you might not be any mental capacity to know anything what's going on. And if you have a legal guardian, we need to let them know about the program so they can go ahead and submit an application on that officer's behalf. The program also provides for heart attack, stroke, and vascular ruptures, that's blood clots, for any public safety officer. So if an officer has any of those events within that 24 hours of them performing any work-related activity, they will possibly receive benefits. So that say that officer was on shift and then they go home the next day and they have that event, they can still apply for their program. Most of these claims are fatal. So most of the people that apply for these programs are their next of kin. So part 2 is our supplemental benefit program. So that provides for officers, you can receive this program if you were injured in the line of duty only due to an act of violence. So even if the officer was in a police chase, that would be considered act of violence. However, if the officer was directing traffic and they were hit by someone who did not do it on purpose, it had nothing to do with arrest, they would not qualify for this program. For firefighters, they have to be injured while fighting a fire. That doesn't mean they're necessarily injured while they're fighting a fire. They could be en route to a fire call. They could be coming from a fire call, but fighting a fire has to be involved in that incident in order for them to apply for the supplemental benefits. So the supplemental benefits, basically we supplement the workers' compensation pay. So for example, if they receive that maximum amount of $800 for workers' compensation, their average weekly pay is $1,500. We will supplement that $700 per week, and I'll go into how that benefit breaks down in a minute. So here's our benefits. So for our death benefits is $150,000. We pay that to what is called we call the unremarried spouse. So the surviving unremarried spouse is someone that will be considered a widow, legally a widow. at the time they're applying for the benefits. Also, for children that are under the age of 19 or under the age of 24 if they're enrolled in a secondary educational program at the time of death. And also, we have to make sure that they're in good standing at the time of death in order to receive the benefits. And also, if the dependents are named on the tax return of the deceased, so the last tax return. So you have to be on the tax return if you're not a spouse or a child of the officer, or we cannot provide you with the benefits. Also, if the officer has children that are not with their current spouse, they can also, their mothers can apply for the benefits, or whoever their legal guardian is as well. So the benefits are paid monthly for up to 5 years, or if you receive a lump sum, they're going to reduce that amount. So also for our total permanent disability benefits, they're $75,000. They're paid monthly benefits for 5 years, or they're reduced if you receive that the lump sum value. The same for our partial permanent disability, they're $35,000. Paid up to 5 years and also reduced. And let me go back to the death benefits. So according to how many dependents you have, we split up that $150,000 between those dependents. So each dependent does not get that $150,000. We split that up throughout to how many dependents the officer has that qualify for the program. So our supplemental pay benefits. So we're going to provide the officer that regular compensation pay that they receive weekly. It doesn't include overtime. It's just their regular pay. So this benefit pays up to 12 months, and that's 12 months from the date they receive their first benefit payment, not 12 months from the date of the incident. So if you have an officer that's receiving sick pay, or some cities have injured on the job pay, if that officer puts that application in within that time period, the 60-day time period, we will hold that application until they receive workers' comp pay. So if they don't receive workers' comp pay for up to a year, we'll hold on to that application and we'll start to pay them after they receive their first workers' compensation pay. Now, if they go back to work full time, then they will not receive, any supplemental pay, but it's only when they receive their workers' comp payment, that first payment. And this is what we will reach out to the workers' comp adjusters for. We will get one of those workers' comp benefit ledgers so we can go ahead and calculate those payments for the officer. And those benefits are taxed like regular wages. That is all worked out through our fiscal department. So we have reasons why the claims are denied, but there definitely will be denied for these reasons based on the statute. So if the officer violates a law that contribute to their death or disability, they cannot receive, their dependents cannot receive the benefits. If the injury or death is secondary to a self-inflicted injury. So if the officer harms himself and they're disabled, based on that, we cannot pay benefits. If the officer commits suicide, we cannot pay benefits to their dependents. Also, if the death certificate states that their death is in the line of duty is secondary to a natural causes, we cannot pay benefits. Also, if the officer is injured or the death occurs while they're performing duties which would not be considered strenuous or dangerous by a reasonable person. So as I stated before, that would be like desk duty. Also, officers who are off duty and who are commuting to and from work would not receive benefits. Only if they had a heart event and it's 24 hours after they have completed a shift, would that type of claim would be considered for benefits. But if they're off duty and they're injured, they cannot receive benefits. And also, I want to add in the untimely application. So if an officer submits an application and it's untimely for whatever reasons, like I said, this program, we're trying to get the word out. Sometimes, the officers don't find out until after the deadline. Even though we would like to approve those applications, we cannot. We have to stick to the statute. And if they're beyond that deadline, we just cannot approve an untimely application unless, like what's happening with with House Bill 1128, if there's a new law in place that gives them a new application window, we can re-review those applications. But if it's untimely for no reason, we can approve it unless the law allows. So the application process. So for death and disability benefits, they have to be submitted within 24 months of the incident, the injury or the death occurs. You submit that information, the application to our office, and I'll give you that information in another slide. And for the supplemental application, those have to be submitted within 60 days from the date of incident. So that's very important to get that out to the officer as soon as possible if you feel they qualify for the supplemental benefits, because they only have 60 days. And that's the reason why the law has changed, that the State Board of Workers' Comp is required to notify any officer that they believe qualify for a program so they do not miss that 60-day window. So after I receive the application from the officer or their dependent, I'll reach out to them. Then I'm going to reach out to the employer and the workers' comp adjuster as needed to get all the documentation I need to determine if we can approve the claim. What I'll do is I'll submit it to my director with the approval or denial request. And if he agrees with that, I'll go ahead and either submit what we call an award letter to the officer or the dependent, or a denial letter. So if if the claim is denied, we do have appealable rights. So the applicant has 60 days from the date of receiving that denial letter to appeal. And our denials, it must be, they must state that there's an error within our denial decision. So it's not a reconsideration. It's that we committed some type of error. And that means that we violated, we denied based on the Georgia law that they feel that they should have been approved, not that we just go ahead and try to reconsider and decide that we want to approve the claim after looking at it. Again, it has to be the error that we did not follow the law, the code for the program. And all our appeals are heard by the Indemnification Commission, and that is our, for the public school teachers, that's through the governor's office, and for our regular denials, that would be held by the commissioner at our commissioner office. So I know that's a lot of information, but we do have a website that has all the information, all our application documents, all the new laws. So this is the link to our website. I'll give everyone a minute to write that down. You can click on that link. There's also videos. All the slides that I discussed today are on the website, and all our program brochures, application, everything is on the website with our contact information as well. So here's our mailing address where you can submit the applications. They can also be emailed to riskmanagement@doas.ga.gov. They can also be emailed directly to me. And once we get those, we get the application, we stamp it with a receive date so we can make sure that we abide by the application deadline. And here's the question. I believe we're going to, everyone's going to submit questions through the Q&A, or they're going to submit questions to Amy.
Cindy Mallett has a question for House Bill 1128. Can you clarify who is eligible for that special application window? Only law enforcement or other categories also?
I'm sorry, law enforcement, public safety officers. So anyone that qualifies for a total permanent disability who has been injured with organic brain injury can qualify for that program. So it's not just law enforcement. It's our public safety officers, which includes the firefighters, EMTs. They can submit the application, but they have to have an organic brain injury for that new application window, not just for any total permanent disability injuries.
Cindy said, thank you for the clarification.
Okay, no problem.
You see,
There's
yeah,
five.
Gail Williams says any consideration of possible dependent not born at time of death, question mark.
No, so our program provides for what is surviving. So that means that the dependent has to be born at the time of death.
And this is Susan Fetterstrom from DOAS. I just wanted to add one other thing that's on our website that is a really nice resource is we have some vignette videos. So it kind of walks through all of the things that Marcellina just talked about in video format. So if anybody just kind of wants to go over all those things again, those videos are available. And those are also really good training resources. So, if you hire someone new in your organization and you want them just to have a really quick resource to kind of get a grasp on what this is, those vignettes are really quick and easy to access. So I just wanted to encourage folks to utilize those resources.
Yeah, you can copy the links from the video from our website and share them if you need to.
Also, Marcellina, Angela Broxton with Chatham County Board of Education. She wants to know if their campus police officers are included in this bill.
Yes. So
go ahead.
So yes. So your campus police officers are they hired? I'm assuming that they work for the county, and they're like school resource officers. They just do duty at the campus. So their original employer is usually like the county or the, from what I understand. So yes, they will qualify for the program. And if they're considered public school employees and they're paid by the public school district, and they will qualify for the program if they're injured through an act of violence by someone who's not a public school employee. So.
We have another question. If you have a permanent partial disability, do you qualify for any compensation?
So yeah, partial permanent disability, we do have a permanent partial disability program. So yes, if they're referring to if they receive just a PPD rating, I'm not for sure, then that doesn't automatically qualify for our program. You have to fit the criteria of our partial permanent disability program criteria, which is a loss of use of one eye, leg, arm, or you're unable to walk without mobility equipment for a short distance. So
Cheryl said, where can we find the videos? Thank you for sharing this information.
Yes, we'll on our website. So we'll share the link.
And then Angela Broxton with Chatham County Board of Education said, yes, they're hired by the school system.
Okay. Yeah. So if they're being paid by the public school system, then yes, they will qualify.
William said, thank you for that information. Everybody's very appreciative, Marcellina.
You're welcome.
Well, if there's any other questions that come up, obviously, Marcellina has given everybody her contact information, but also you can contact GWCA director at gmail.com, and we'll make sure that any questions get to Marcellina. Also, if you have an opportunity and you're not a member of the GWCA, the Georgia Workers' Comp Association, please feel free to check out our website, gwca.info. We are working very hard to put together some legislative heavy lifting for insurers and self-insured. So any support we can get, we would really appreciate it.
Thanks for tuning in to Workplace Health. I appreciate you spending your time with me today. Don't forget to follow us on social media, subscribe, leave a review, and share with an industry professional. Stay curious, stay kind, and we will see you next time.